Very good afternoon and welcome to the session on routine vaccination in children. We are glad to have Dr. Alok Gupta among us today to help us understand the topic. The doctor will discuss the topic briefly and will take us through and more in the session as we go on. If you have any questions, just drop down on your comments. Doctor, you have the stage.
Okay. Hello, good afternoon. My name is Dr. Alok Gupta. I am a consultant pediatrician and neonatologist at Apollo Clinic in Noida. Today, we'll talk about the importance of routine vaccination in children. As you know, one of the best ways to keep your child safe and healthy is to ensure your baby gets its shots on time. I know no parents can bear to see their child in pain, and so parents usually tempted to put off their child vaccination. But there is a popular saying, "No pain, no gain." So these vaccines are very important to your child, and should not miss your child vaccination. Why these vaccines are important? Vaccines offers lifelong protection from the various deadly diseases like diphtheria, pertussis, measles, chickenpox, hepatitis A, hepatitis B, to name a few. So first we will know what are the vaccines and how do they work. Basically, vaccines contain weakened or partially dead antigens. Antigens means they are the viruses or bacteria. They are already dead or very weakened form. That enables the child immune system to recognize and fight the virus if it ever enters child's body. So it is essential to immunize your child at appropriate age. Most vaccines require a booster doses in addition to regular doses for production of lifelong immunity. So why vaccines are important? Why we should give our child to vaccines at per schedule? Because vaccine shots prevent kids. First of the is foremost importance is this vaccine shot prevent our disease from severe illnesses. We can know there are some unfortunate countries like sub-Saharan Africa where the vaccine coverage is not adequate. Thousands of children are dying every year from diphtheria, pertussis, measles, as compared to developed countries where these vaccines coverage are really prevalent. So, Indian Academy of Pediatrics and Center for Disease Health I strongly recommend vaccines to your child. If child are not vaccinated, they will spread the disease to other children and those babies who have reduced immunity, like those babies who have chronic lung disease from the childhood, chronic heart disease, or chronic kidney disease. Vaccines are one of the most important thing you do to maintain the health of your child. It can prevent serious diseases on long term as well as the lifelong basis. Many parents stick to the schedule during the first year. After first year, they neglect the child vaccines. Many parents think that during first year, the vaccines which are given are important, but second year onwards, these vaccines are not important. It is not like this. During second year, we usually give hepatitis A, chickenpox, DPT booster, MMR, meningococcal vaccines, which are really really important. Like firstly, meningococcal meningitis caused by this vaccine. It is very vaccine preventable disease. It causes meningitis in the children. It has very high mortality, and if child is able to survive, they have lifelong neurological sequelae as well. So you must give your children these vaccination after 1 year also. As per one study, it has been estimated that as far as 31% parents usually delay their child vaccination. In the COVID era, we have seen that many during the COVID lockdown period, many parents did not uh, went to their pediatrician for their childhood vaccination, and these vaccinations are long pending. So you have to remember that these diseases like pertussis, diphtheria, measles, meningococcal meningitis, chickenpox. They are not more severe, but they are as deadly as the COVID. So you must give vaccination against these diseases to your child. Some vaccination tips you have to adhere while going for vaccination for your child. First, adhere to your child vaccination schedule as far as possible. When you go to a pediatrician, we usually write the next date of vaccination as well, and you have to stick to a schedule. In case your child has fever on day of vaccination, you have to inform your pediatrician. After proper examination, your pediatrician will tell you whether it is safe to give vaccine or not. Third, fever may develop after some vaccines. Your pediatrician will advise you regarding that. Like some vaccines like DPT, which are given usually 6, 10, 14 weeks and booster at 15 to 16 months. There are one wholesale vaccine which causes fever and pain in injection site. Now there are painless vaccines also, and there are feverless vaccines also which has come. Your doctor will advise you regarding that, and you can take a decision regarding this. Both painless and painful vaccines are equally efficacious. Only difference is price. You can go ahead for both these vaccines. If fever occurs, usually subside in 2 or 3 days, and there is no long-term complication. Third, you may also carry your child's favorite toy, a blanket, during for their comfort. During vaccination, you may distract your child with some videos or their favorite toys during vaccination. After most of the vaccine, you can feed your child 10 minutes after vaccination. You can console your child. Now we will come to this vaccine schedule. In our India, as per the IAP recommendation, at birth we usually give the polio drops, hepatitis B and BCG as a routine vaccination in both private and government setting. It is essential and mandatory. You should give your children these vaccines. Then at 6, 10, 14 weeks, we usually give vaccines two injection. One injection contains hexa. It is diphtheria, pertussis, tetanus, H20B, hepatitis, and polio. These are hexa vaccines. Second is pneumococcal vaccines, and third is the rotavirus vaccine against diarrhea. These three vaccines are at a 6, 10, 14 weeks are similar, and it is mandatory vaccine. You must give your child these vaccines. Then at 6 months of age, we usually give polio drops, and as per IAP schedule, there is flu vaccines are given at 6 and 7 months of the age, and these flu vaccines are given once a year till 5 years of the age. It is optional vaccine, but if in case of COVID era, if your child is recurrently having fever, cough, cold, you should give your child these vaccines. Then at the age of 6 to 9 months, you should provide your child typhoid vaccination, as well as at 9 months you have to give child MMR vaccination. These vaccine schedules are maintained as per the large serological data, and these are really important that you stick to your schedule. As I said, at the age of 12 months and onwards, like at the age of 12 months, we usually provide hepatitis A vaccines, and 15 months we usually give the DPT booster, polio booster, as well as chickenpox booster. These vaccines are again mandatory. You should give your child. Some such vaccines which are not provided in the government setup, like chickenpox, hepatitis A, as well as influenza vaccination, you can get from the private setup. Now, once again, I can say the best vaccination is the best way to keep your child safe and healthy, apart from the proper nutrition as well as the cleanliness. Some parents say that there can we miss vaccination, can we avoid vaccination, as certain reports of autism coming after the MR vaccination, and some parents come to our OPD and say that MR vaccinations can be avoided, doctor, this because this vaccination is leading to autism. But we have done a large survey, as well as there is no medical evidence which suggests that the MR vaccination causes autism. So you must give your child vaccination against MMR, and WHO recommend this vaccine also. Thank you. Now I will Is there any questions I would like to answer? Is there any questions? Thank you very much. Good day.